I now call the meeting to order. The agenda has been sent to members. Please invite the officials to join us. We have Professor Sophia Chan and Ms. Chair. Dr. Lam. We have two items for discussion. First, progress of the integrated Chinese Western medicine pilot program. Second, registration of proprietary Chinese medicines. Over to you, Undersecretary, for an introduction of your paper. Thank you. Maybe let's take up the first item. And here's a recap. In April, on the 14th of April, some members on the question of development of proprietary Chinese medicines asked for supplementary papers from us. We have therefore submitted a paper on the progress of the integrated Chinese Western medicine pilot program, and also we have provided a paper for the second item. And also we have provided some statistics on the migration of proprietary Chinese medicine from transitional registration to formal registration. Today we also have Dr. Ronald Lam from the Department of Health, as well as Dr. Eric Xie and Ms. Henny Hui from Hospital Authority. Dr. Xie and Ms. Hui will be participating for the purpose of item 1, and we have provided an information paper to this subcommittee. And then Ms. Hui will also participate in the discussion of item number 2. On the question of integrated Chinese Western medicine pilot program, here's some background. The CE established the Chinese Medicine Development Committee in 2013 to focus on 4 major areas: development of Chinese medicine services, personnel training and professional development, research and development, and development of Chinese medicine industries, including Chinese medicine testing. And under the committee, there are 2 subcommittees, and they are tasked to advise on the integrated Chinese Western medicine pilot program to the government. On the question of Chinese medicine hospital, we have the necessary conditions to develop the services offered by Chinese medicine hospitals, and we believe this would be good for professional development. We want to operate the Chinese medicine hospital, which is led by CMPs, and there should be also integrated Chinese Western medicine services. And this will also provide the necessary facilities to support the 3 institutions offering the Chinese medicine programs. And it will also strengthen and enhance professional training and scientific research of Chinese medicine in Hong Kong. Since the development of a Chinese medicine hospital requires detailed planning, therefore we agree with the committee's recommendation that before we build the hospital, we should carry out thematic studies to learn from the experience of ICWM, or Integrated Chinese Western Medicine services, so as to build a foundation for the Chinese medicine hospital. The government has commissioned the HA to implement the pilot scheme. Regarding the design of the pilot scheme, the clinical framework, and also the details are under the pilot program, you can all please refer to paragraphs 7 to 17. And let me now turn to clinical training for local students of Chinese medicine. Well, this operational mode will be conducive to providing quality clinical services, and also to promote and develop training, and also to encourage professional development in Chinese medicine. The government would learn all the lessons from the pilot schemes and to enhance training with the relevant parties, including the enhancement of clinical practices. The proposed Chinese medicine can also provide facilities, as I've said, to support the 3 universities and other post-secondary institutions in relation to research and clinical training and practice opportunities for Chinese medicine. This would enhance the quality of Chinese medicine research, and details can be found in paragraphs 18 to 20. And in the light of a member's comment, the HA has made all the necessary preparations on the 22nd of September next year. On the 22nd of September 2014, the phase 1 of the pilot scheme was launched in Tuen Mun, Eastern Netherso Hospital, and Tonghua Hospital. And they covered particular areas: stroke care, acute low back pain care, cancer, palliative care. In a moment, I will ask the HA, Dr. Chia, to brief members on the phase 1 of the pilot scheme. That's all for my introduction, Chairman. Do we have anything else from the professor? Dr. Chair, thank you. Yes, let me briefly report to members the state of affairs with the pilot scheme. As the Undersecretary has said, it started on the 22nd of September, and in the 3 hospitals, there were Chinese medicine clinics and involved in the ICWN. As at the end of April, we have involved more than 100 persons. We want to look at the workflow and the management of patients and relevant legal issues in the context of public hospital. So the number is not very big. And we have to look at risk management of both CMP and Western doctors, and also the management of these pharmaceutical products. And you know that the computer system in our hospitals is English-based, but the CM clinic is Chinese-based. So we need to make adjustments. And in the wards, our healthcare workers, in particular, nurses, they have to handle the dispensing of both Western medicines and Chinese medicines. So we need to come up with guidelines and some code of practice so as to ensure safety of using drugs. In the HA, we have a risk management and reporting system, and the Chinese medicine clinics are covered by this reporting system. If there are risk incidents, we can make the necessary reports immediately. So these are all the clinical management measures. And as the Undersecretary has said, we are now covering 3 disease areas, and we have devised the protocols which is scientifically based and evidence based, and we wanted to be strict at first on which patients can be admitted as we progress, we understand that the initial criteria worked, and so we have relaxed the criteria now.
5分鐘。
Mr. Wong Ting Kwong, 5 minutes. Thank you. Why have you chosen these 3 diseases, namely acute stroke care, acute low back pain care, and cancer palliative care? There are particularly more patients suffering from these diseases. And for patients who would like to join the pilot program, what channels do they have? And can only patients treated by the cluster hospitals be eligible to join? Thank you, Mr. Wong. The selection of the 3 diseases is based on certain criteria. First, there must be evidence base and scientific proof that Chinese medicine can be effective in the treatment of these 3 diseases, and there must be a certain patient population to ensure critical mass. And thirdly, we must have clearly defined inclusion and exclusive criteria for these diseases. Based on these 3 criteria, stroke care, acute low back pain care, and palliative care for cancer have been selected. Regarding how patients can opt in, they have to be patients of Tonghua Hospital, Pamela Yud, Natherson Eastern Hospital, and Two Moon Hospital. Perhaps Dr. Xie can supplement. Thank you. These 3 pilot programs are mainly led in the public sector, by the public sector. Now we have got a treatment protocol for each of the 3 disease areas. Take stroke care as an example. If the vital signs are stable and the patient can fulfill the selection criteria, then we will invite him to join. So this is one of the ways to join the pilot scheme. And once a patient has opted in, we will have colleagues to explain to him the kind of treatment he will receive in Chinese medicine. And he can also choose to drop out, given that this is a voluntary scheme. So in the treatment process, a patient can choose to drop out at any time. There are a few criteria for making this decision. For instance, there is no obvious positive effect or effective outcome, and or there may even be some adverse signs. And of course, the patient's volition is to be respected. Take stroke care as an example. Can only patients of Tonghua Hospital join? What about patients from the Eastern Hospital and Two Moon? Can stroke patients from these hospitals join the pilot scheme in Tonghua? So can only patients of a particular hospital join the pilot scheme of that hospital? Yes, many patients from these hospitals. Now, take Two Moon as an example. It is the hospital selected for cancer palliative care. So cancer patients in Two Moon Hospital that suit the selection criteria can join. Mr. Wong may think that the scope is too narrow, but given that this is just phase 1 of the pilot program, we need to work out a lot of guidelines because this is the first time, and we would rather err on the side of caution. And so that's correct. May I give you a word of advice? I think the pilot scheme is good. It is a positive measure for integration of Chinese and Western medicine. Unfortunately, the scope is far too narrow. When can the second phase start? Where can phase 2 start? And can it be widened? Why is the scope so narrow? Is it because of the want for resources? It's just that we want to carry out phase 1 first, and then we can have an interim assessment for improvement. When are you going to kick off the second phase? Dr. Xia? Thank you. Tomorrow at HAE's directors meeting, we're going to make a report, and we hope to start phase 2 in the 4th quarter of this year, and 4 more public hospitals will join. Do you have sufficient resources? Thanks to the support from the HA, we do have sufficient resources. Ms. Alice Mack. Chairman. According to the paper, you only have to pay a daily service fee of $200 for consultation, decoction, and acupuncture. Recently, I met a trade union of massage from center of FTU. I'd like to know whether acupoint massage will be regarded as a form of Chinese medicine, and can you include acupoint massage into the professional services of HA? Dr. Xia? Well, all the 3 case areas or patients of these 3 case areas will be treated according to the respective protocol. So in Chinese medicine, we have consultation medicine and acupuncture with an expert group, and they have proposed to add massage for stroke care and acute low back pain care. Please give me some information after your discussion, because the trade union would like to help patients more professionally. They want to relieve the conditions of patients. So can you please tell us how you're going to include massage into your treatment protocol? Thank you. Mr. Yu, I apologize for being late because I was in an interview. No, for Chinese medicine, we know that many medical Chinese practitioners are already permanent residents in Hong Kong. Will you make arrangements for these Chinese medical practitioners to sit for licensing examinations in Hong Kong? Because I believe their expertise will be certainly be no inferior to their counterparts in Hong Kong. And I think the remuneration of Chinese medical practitioners is not too generous in many NGOs. Now, we are not discriminating against Chinese medical practitioners. Relatively speaking, they can be licensed easier than their Western colleagues. But can you classify different types of organizations? So for Chinese medical practitioners that are more experienced or specialized, they can be better remunerated so that you can attract more young people to join this profession. Otherwise, young people may think that, well, it's pointless if they can only make $10,000 odd in a month. Yes, we are going to talk about treatment centers and the remuneration of CPMs later, but the subject for this item is the pilot program of integrated Chinese Western medicine. So I think it is a concern of the when it comes to remuneration of the CMPs participating in this pilot program. All right. If mainland experts would like to take part in the pilot scheme, can they be employed? Professor Chen. Thank you, Mr. Yu, and thank you, Chairman, for your question. Dr. Lam may respond to Mr. Yu's first question, and that is the licensing system for CMPs. Thank you. The legislation has authorized the committee on CMP to run a uniformed licensing examination for aspiring CMPs. For instance, if we have local students being trained on the mainland, or we may also have CMPs trained on the mainland. Now, if we talk about those from the mainland, first, they must have the recommendation, or their institution must have the recommendation of the state authority, and graduate from such an institution can take part in a uniformed licensing examination in Hong Kong. So whether it be students trained in Hong Kong or on the mainland, they have the same licensing arrangement. Regarding remuneration, we do understand the industry's aspirations. Mr. Yu, as well as some practitioners from the industry, have expressed this concern to us. We have CMPs in private practice and some employed by chain Chinese medicine organizations. As Chinese medicine becomes more popular and the profession more recognized, I'm sure the remuneration of CMPs will gradually be increased. The pilot scheme is an important step to enhance the professional image of CMPs and to enhance public recognition. And for CMPs working in CMCTRs, that is universities, clinics of the HA, so on and so forth, we understand that their remuneration is being improved because HA has been discussing with NGOs. Although it is for the NGOs to determine the pay and conditions of the employees, the HA has been discussing with them with the view to enhancing the remuneration of the CMPs they employ. All right. In phase 1, you have 3 public hospitals. Can you start with these public hospitals? For instance, there can be different ranks within this profession. Of course, we cannot compare them with CMPs employed by Chinese medicine drugstores. But can you start with the hospitals of this pilot program? Thank you. The purpose of the pilot scheme is to study the operational mode of operation, and second, the effectiveness of integrated Chinese Western medicine treatment. They will form the basis for the setting up of a Chinese medicine hospital in the future. And these CMPs are not employed by the HA. We mainly rely on CMPs employed by the tripartite CMCTRS. And that's why patients have to pay a fee. Of course, we can adopt a two-pronged approach. This is just phase 1, and phase 2 will be implemented before the end of this year. We hope that the clinical experience and mode of operation will form the basis of the future Chinese medicine hospital. And as for the remuneration of CMPs, this is about the professional development of the sector, and perhaps Dr. Xie can supplement.
As the Undersecretary has informed you, well, the CMPs are those deployed from the tripartite clinics, and these CMPs are employed by the NGOs concerned. Well, the framework was set when the tripartite arrangement was implemented. They have a junior CMP, CMP trainee, then CMP, senior CMPs, and a consultant CMP, and that's the ranks they have. I know a CMP who was sent to Beijing to study cardiology through the government funding. And the CMP was frustrated because in Hong Kong, cardiology belongs to the field of Western medicine. It's good that we have integrated Chinese and Western medicine, but if you just adopt the past practice, but if you want the CMPs in these 3 hospitals to develop professionally, then there will be no need to send that CMP to Beijing to study a specialist service. And now you want to apply the international practice on Chinese medicine and CMPs. Since Western medicine has already been well established, are you going to carry out the pilot and test it out on Chinese medicine? If that's the intention, that is very good. Please don't just look at the status quo, and if the status quo is all right, well, you just adopt the past practice. Hospitals will have to pay attention to costs, but if it's promoted by the government, that is a different matter. I would like to see that we can really see enhancement and professional development. Undersecretary, on the question of professional development and the multi-pronged approach that we have adopted, I would like to say something on those, and Dr. Chair can tell you the arrangement adopted by the HA in sending people to receive training. Well, in 2013, the Chinese Medicine Development Committee was set up, headed by the Secretary. And the committee looks at training and professional development of Chinese medicine and Chinese medicine practitioners. And Mr. Yu, you have referred to cardiology. That may be a specialty of Chinese medicine, or they may be doing the training to prepare for future specialist development. Dr. Chair, maybe you can provide the committee with more information? Yes. The HA and the tripartite Chinese medicine clinics have been given some funds so that the CMPs working in our clinics can go to the mainland to receive further training. There are junior scholarships and senior scholarships. Young CMPs will send to the mainland to gain the experience. And then for senior CMPs, they will receive trainer for the purpose of train the trainer. First, because we don't have many specialists, so we send our CMPs to the mainland. We send people up north to the mainland, and also we recruit CMPs and professors in Chinese medicine from the mainland to teach the clinical courses in Hong Kong. So you haven't said anything about the development of the hierarchy, professional hierarchy of CMP through the pilot scheme. We must get some we want to get something developed along the line of Western medicine. Of course, I don't think we should ask CMPs to get a lot of additional licenses before they are specialized. It's difficult to ask existing hospital to do this. But if we can do this through the pilot scheme, those who are admitted to the Chinese medicine hospital will get good remuneration, and then we can have a very well established specialist system. This is what I mean by positioning. Is that the positioning that you have in mind? Thank you. Thank you for the question on positioning. Under this phase 1 of the ICWM pilot program, the pilot program, we are not really focusing on professional development of CMP, but rather the collaboration between Chinese and Western medicine, the clinical protocol, the efficacy, and the patient's response to such treatment. But are we ignoring the development of CMPs and specialist development? Of course not. Well, we have the Chinese Medicine Development Committee, and HA is also assisting the tripartite Chinese medicine clinic in all the 18 districts. They were looking at remuneration of CMPs, the setting of ranks, and since we are going to develop a Chinese medicine hospital as well, so we can see a lot of professional development opportunities. And the Chinese Medicine Committee is also looking at all these. They would be taking forward such developments in collaboration with the HA. Well, Mr. Yu will be looking at remuneration, professional development, and the development of a specialist service in the later stage. All these are issues of concern to CMPs. And we would like to have good communication with the Chinese Medicine Practice Subcommittee under the Chinese Medicine Development Committee. would like to know from the government how you're going to promote Chinese medicine in Hong Kong. But maybe this should be for meetings in the future. Members, other questions? Do you have other questions? If not, then I would like to raise one. In the paper, it's mentioned that the committee chaired by the two secretaries has two subcommittees. They all have meetings, but we cannot find their meeting minutes, so we don't know the issues that the two subcommittees are paying attention to. And I believe the Chinese Medicine Hospital must be one of those issues. You want to create a system for the future Chinese Medicine Hospital. In the Chinese Medicine Hospital, it will not be led by Western medicine practitioners, but for the CMPs now working in the pilot scheme in the hospitals, well, these hospitals are run under the direction of Chinese medicine practitioners. Will these CMPs be subject to a lot of rules that may be cumbersome and unnecessary? Does the government has an overall plan with regard to the pilot program and an objective in mind? Do you want to have comprehensive coverage, or what disease areas will be covered? Are they going to be part of the long-term healthcare program of our hospitals? And if we look at the figures for the three hospitals, it's all about a year already. It's only 100 or 200 patients who have been screened in. Only 30 or 40 have enrolled. Is it because of the lack of sufficient number of CMPs, or the program is not attractive, or the cost of the fee is too high? Three questions. Do you have anything to offer at this stage? I would briefly respond to the questions, and then I'll ask Dr. Chair to supplement. In the future Chinese Medicine Hospital, it will be led by CMPs, and there will be collaboration between Chinese medicine practitioners and Western medicine practitioners. So there's no question of the Chinese medicine hospitals being led by Western medicine practitioners. If we look at the first hospitals using this mode of operation on the mainland, they also have Western medicine practitioners, but they are all led by CMPs. Since we don't have CM hospital, if we want to try out, we want to implement a pilot scheme, the only way to do it is to do it under the hospitals designated in the law. HA doctors have to be ultimately responsible for the care of their patients. So in the integrated pilot program, well, the ultimate responsibility of caring for the patient rests with the Western medicine practitioners in these hospitals. But the treatment, the protocol, will be led by CMPs. I think Dr. Chair can tell you more details. As for the coverage and the selection of disease areas, well, in the first phase, there are 3 disease areas tried out in 3 hospitals. In the next stage, we're going to have 4 more hospitals. Dr. Chair can tell you more. And also, Dr. Chair can say something about the initial findings in the review with regard to the 100 or so enrolled patients. The Undersecretary has looked at the constraints with regard to Chinese medicine. In the workflow, although there is in a Western medicine hospital led by Western medicine practitioners, but when it comes to the treatment protocol, for example, both the CMPs and the WMPs would be providing clinical care. They do the rounds together, and if there is discomfort or there may be the need to adjust the protocol, the two categories of doctors would discuss and make the changes. And in the treatment protocol, the CMPs are clearly leading the treatment. We have come up with interim report on the review of the pilot program. We would like to do some assessment so that to inform us of necessary amendments to the programs before we have the 4th hospital joining the scheme. We'll have to look at the logistics, the workflow, the law, and also whether the guidelines are clear enough. So we do not attach the highest importance to the number of patients. But you may ask why the number is on the low side. We have conducted an interim review. Starting from the 22nd of September to this time, we have the winter surge of seasonal flu.
So we have therefore designated one ward in one patient for reception of patients, and the number of beds is limited. And secondly, this is just a startup stage, and it's the first attempt to set up such a mode of operation in a Western hospital. And so we have reviewed the criteria, and we think we can relax it a bit. At first, we have excluded all patients over 75 years old, but there are many stroke patients who are around 80 years old, and their general physical conditions are acceptable, so we have relaxed this restriction. And for the computer system, because the two computer systems could not talk to one another in the beginning, and many things had to be done manually. And after we've reviewed the process, we have made improvements. As for verification of patients' identity, the manpower requirement has reduced by almost 40% as a result. And fees and charges. It's true that some patients feel that the fees are a bit dear, but we're also told by some patients that for every consultation done by CMP in ward, it will be anything between $800 to $1,000. So what we charge here is only $200 for everything, including consultation, decoction, and acupuncture. And some patients are saying that our rate is very low compared with the market rate. And we have to be very careful in the process, because there are a lot of interactive reactions. Many reactions are between Chinese and Western medicine. So we have set up a expert group to see how risks involved can be managed, and therefore, in the first place, we want to adopt a gradual approach, and will gradually increase the number of patients intake. Well, many things have already been done or designed on the mainland. They have lots of experience in integrated Chinese Western medicine. I think we can borrow experience from the mainland. There is no need for us to move in a snail pace. It would take a long time for things to be set up. Mr. Wang Tianquang. Of course, there are different ways of treating diseases. In Hong Kong, Western medicine is the dominant school. It's true that Western medicine has more comprehensive clinical evidence and scientific proof, but I think it is an excellent idea to integrate Chinese and Western medicines. However, in Hong Kong, currently the boundary between the two schools of medicine is very clear. We are talking about integration, but what will happen to the following areas? For instance, from what I've heard, Chinese medicine cannot use a syringe for injection. And Chinese medicine also cannot ask for certain laboratory tests, but the availability of laboratory reports would help to enhance the accuracy of diagnosis and treatment. I'm sure it would be of benefits to the enhancement of the profession as well. In fact, the mainland, the mainland has a very long established history of using both schools of medicine in treatment. So I think there can be professional visits to the mainland. For instance, acupuncture. Do you think they still use human hands to do it? In fact, they have electronic means. The operation can be done electronically. So I think we should learn from them. We should expedite the process. That would go a long way to improve public health. Thank you very much, Mr. Wong, for your very valuable suggestions. Of course, we have relevant legislation to regulate what can and cannot be done by CPMs and Western doctors, respectively. But we have already made the first step. We have made a start in the integration of Chinese and Western medicines. Dr. Lam can supplement later. I think this is the right direction we are moving towards, and I believe the assessments under the pilot program or the review of the pilot program may result in enhancing the role of Chinese medicine, and will also gauge the acceptability of patients. And when we really launch Chinese inpatient treatment in a Chinese hospital, Chinese medicine hospital, we have a lot of areas to consider. Dr. Lam, do you have anything to add in terms of the respective roles of CMPs, CPMs, and Western medical practitioners? Well, it is clearly defined in the relevant legislation. Chinese medicine can only be practiced under the guidance of traditional Chinese medicine theories. It would like to use modern diagnostic tools. Then I will have to see whether the tools are being used in Western medicine as well. For instance, a traditional Chinese medicine will not have diagnostic tools such as ultrasound machine. So we have to ensure that Chinese medical practitioners are using their own traditional expertise if they need supportive devices to for diagnosis, they may need to do it together with other professions, not necessarily Chinese, Western medical practitioners. I've heard calls from the industry as to whether CPMs can directly refer patients to an X-ray, but even for radiographers, they have very clear legislation to regulate their practice. So the emphasis of the pilot scheme is to ensure synergy and coordination among different professions and come up with the best model. Mr. Wong, well, CPMs rely on looking, smelling, palpating, and asking. This is already an old school. Dr. Lam talked about X-ray examination. Well, in Western medicine, it's very commonly used, but when there is a bone fracture, should CMP only rely on feeling or palpating? You must really remove the restrictions, otherwise the hands are tied. Well, if the legislation is already dated, you should amend it. We must remove the various restrictions on the practice of Chinese medicine. Maybe it's just my misconception. To a certain extent, WMPs, Western medical practitioners, are very protective of their own profession. In fact, our public interest should precede their interest. In fact, even WMPs can acquire treatment skills in Chinese medicine, so we should not be so narrow-minded. So please review the outdated legislation and review it or amend it in a timely manner. Professor, thank you, Mr. Wong, for your comments. Dr. Lam already explained the legislation to members. And when CMPs were trained, the type of training they receive will determine how they practice. If we like to enhance the ability or the competence and roles of CMPs, then we'll have to look whether in their training they have got the relevant knowledge and skills. We may have to enhance their training of skills and knowledge if we want to do so. The experience we gain from the pilot program will help us. It seems that there are more and more CMPs taking up studying Western medicine and vice versa. There may not be too many cases, but gradually we have to enhance. I think it is important for different professions to enhance their understanding of another developing profession. For instance, nursing. Nursing training covers some knowledge about Western medicine as well. Dr. Xie, any supplement? In fact, there is this sense of protectionism among WMPs. But how can we break the barrier? Some professions cannot even make referrals. for certain diagnostic tests. And I think Mr. Wang Tingguang is very correct. You should consider the best interest of patients instead of a certain profession. In the mainland, many CMPs use Western medicine skills to treat patients. Mr. Yu? Well, this is integration of Chinese and Western medicines, and we should adopt a broader view.
Under the pilot program, you cover 3 disease areas. I think you should assess what division of labor should be set. On the 3 disease areas covered, have you, first of all, understood the demand level and also the efficacy as well as the patient's response? And if the findings are good, then is it cheaper to go for Chinese medicine vis-a-vis Western medicine? Or if the demand is good and the efficacy is also good and the cost is lower, so can then the Chinese medicine hospital play a supplementary role or complementary role to the other hospitals? So can you look at the findings to see if they are better and more cost effective? I'll ask Dr. Chair to say something. We will cover certain angles in our review. Thank you. With regard to the issues raised by Mr. Yu, first of all, on the skills required, we are in the process of exploration. For example, for stroke care or cancer palliative care, we have Chinese medicine and acupuncture. Our healthcare people do not know a lot about Chinese medicine, so we provide them with training to enhance their professional knowledge. So that we can bridge the knowledge gap as far as possible between Chinese medicine and Western medicine. So we'll be working on skills enhancement like that. Secondly, as the Undersecretary has said, we have commissioned a third-party firm to assess the entire program, including patients' satisfaction, the stakeholders' views, HA, our partners, the NGOs who offer the CMPs, their roles, the division of labor, is it clear, and can we meet the objectives we set for ourselves? And also we'll look at costs. Or can we find some savings, as the member has suggested? We also look at the outcome of the patients covered in those disease areas. So we look at the outcome of compared with Western medicine treatment. Of course, this is not a research project. For example, we look at the patient days, the hospital days, whether there's a reduction, or would it mean that there's a longer period of hospitalization? When will that be completed? Well, there are certain milestone dates. In September, we are going to have the first report, and then an interim report next year. And after 2 years or more, after the completion of the pilot program, there will be a final report. Covering all the 3 disease areas? Yes. Mr. Wang Tingguang, last round, please. Thank you. I thank the representatives from the Bureau and the HA for telling us the the training offered? Well, the names of the training courses are not important. The important thing is the content. If we just follow the traditional training area and not those for which that we are going to achieve certain objectives, so what's the use of sticking to the traditional training areas? Because that will mean that we cannot promote integration or collaboration. If you want to change the contents of the training program, there's a hurdle. Well, because there are relevant rules in the law. If you want to move beyond the restrictions, you may break the law. You must take away this obstacle so that those who are aspiring to be trained in the integration of Chinese and Western medicines will be deterred. I know your concern is that whether public health or will be jeopardized by quacks. I understand your concern. Maybe you can change the law that on certain specified premises, for example, in some restricted area, Chinese medicine can be allowed to go beyond certain boundaries. For example, in a public hospital, you set aside a particular clinic or area for such trials to be carried out. Well, I believe you can count on support from this council, and I believe it's a better approach. Under Secretary, thank you, Mr. Wong, for your suggestions. We are going to have a Chinese medicine hospital that will give us a lot of scope in developing Chinese medicine and in promoting collaboration between Chinese and Western medicines. On the areas you have referred to, we certainly conduct a review, because if we going to allow inpatients in the Chinese medicine hospitals, we need to consider views expressed through various quarters and also views expressed in this committee. The Chinese Medicine Practice Subcommittee of the CMDC will certainly look into all those areas, and I will take your views back for their consideration. I would like to ask a few questions, ask for some answers for some remaining questions. Well, the CMD committee has convened meetings, and also the two subcommittees. Can the minutes be made available? Because we would like to know what have been discussed. And now it seems that none is available. And also for the collaboration, do you have a comprehensive plan? Do you have an objective? And that is in relation to the coverage. Are you going to cover all disease areas, or are you going to cover specified areas only? Although we are still trying to work out how the Chinese medicine hospital is to be run, but you need time, quite a long time, to build the CM hospital. If you wait until you have got the plan ready, the operational system ready, it will take a long time to see the hospital really operational. So first question, CMDP and the minutes. Second, the coverage, and also the operation system of the CM hospital. The Chinese Medicine Development Committee and its two subcommittees have been working in earnest and have convened meetings, but they are not the Legislative Council. Their meeting minutes are not made available to the public. But if you want to know the progress of their discussion, if I remember correctly, we did report to the panel. We can provide timely report on what the committee and subcommittees have discussed and the progress that they have made up to a certain time. And I'll ask Dr. Chair to supplement. I would like to say something about the coverage of the pilot program. Well, the pilot program is going to be limited in scope. There will be 2 phases covering 7 hospitals. The first one started on the 22nd of September. In the 4th quarter, we are going to launch the second phase of the pilot program. Both phase 1 and phase 2 will last for 2 years, and then another 6 months. So all these phases will be completed in 2018. How about Chinese Medicine Hospital? Well, in the CE's policy address, it's been announced that first we are going to have a Chinese medicine hospital, and a site in Jiangguanhou has been reserved for building the hospital. I know that the sector and relevant stakeholders would like us to set the timetable and also devise the operational system. Now we are adopting a multi-pronged approach to take it forward. We're trying out this pilot program to look at the clinical framework and also how the services can be rendered. We have already positioned the CM hospital as one led by CMPs, and second, it's going to be self-financing.
委員會下邊，尤其是咧係嗰個中醫。
And under the CMD committee, and especially under the committee, the Chinese Medicine Practice Subcommittee have been holding discussions, and they will be advising the government on the management and operation system for the CM hospital, the requirement on medical equipment, and all those specialist manpower planning, manpower training to support the hospital. And some members have mentioned the division of labor, the delineation of responsibilities of different personnel. So it covers quite a big field. So we would like to carry out more pilot programs and conduct studies to accumulate some experience under the integrated approach, so that we can have a sound foundation to launch the Chinese Medicine Hospital. So there's no concrete timetable when the Chinese Medicine Hospital will be launched. Correct. Yes, we are still in the initial stage. The site has been reserved, and we will be carrying out pilot programs. And once we have got a concrete plan for the new hospital, we'll come back to report to you. So we have spent quite some time on this agenda item. It's time to move on to the next one, updates on the migration of proprietary Chinese medicine from traditional or transitional registration to formal registration. Actually, we have discussed this on a number of occasions. Over to you, Under Secretary. So this is the second agenda item, and that is the migration from transitional registration to formal registration for proprietary Chinese medicines. In paragraph 9 of the paper, we already mentioned that the CMB under the Department of Health has been handling the migration. At present, there are 8,500 products which have been issued a Hong Kong P or notification of transitional registration. The government has contacted the CMB, and we know that as at the 7th of May 2015, about 18% of those products have yet to submit the quality and the stability test reports. According to the CMP, for those products with HKP, the submission of test reports and also the test reports on the first batch of products remains the same, and that is before the 30th of June 2015. The relevant parties have to submit the relevant documents on product quality, product efficacy, for those who have failed to submit the reports by the 30th of June 2015, the CMB would take the following action.
After
June the 30th, for holders of medicine without submitting the relevant documents will be issued a notice for submitting the documents. They will be given 3 months to do it, and the holder has to submit all the reports on stability and efficacy within 3 months. And to give justifications as to why such reports were not submitted before the deadline. For instance, the relevant laboratory will have to issue objective evidence, such as only some reports were issued. Otherwise, the committee may reject the application for registration. In fact, on the 18th of May 2015, all the stakeholders were informed. Manufacturers, mainly the patent Chinese medicine manufacturers, received the decision on that day. Thank you. So just background information for your information. Now there are 8,000 types of drugs with HKP. They like to be registered as HKC. How many of the old medicine have not submitted the testing documents, and if they can't provide them before the 30th of June, they may lose the status. According to the Department of Health, 8,500 have been given HKP. About 1,530 or 80% of them have not submitted anything so far. So we may lose more than 1,000 subsequently. We have discussed the registration of such medicine in the past. We know that the progress will be slow. We asked for the reason why. An application from HKP to HKC is moving very slowly. 3%, only 3% of the HKP medicines have been able to be registered as HKC. So we asked a number of questions, and according to the industry, they could not find the right laboratories to do the tests for them, and some said that they didn't have enough money to do it. So we are conducting discussion, and then on the 30th of June there will be this problem. Can I ask for the reason why? Well, 1,530 wanting to become HKC, and they're required to provide information. Have you got any information as to why they haven't applied, and is there any support for them? Well, what else are the channel of communication? Well, we have a very close communication with the industry, and we've also offered assistance. And the deadline is not the first one we set. If you ask the doctor, you know that many years ago we have set different deadlines, and we have given a lot of accommodation, and this is the last deadline. Dr. Lam may want to supplement. As said by the Undersecretary, the communication channels are always open. We have monthly briefings and meetings regarding the deadline of the 30th of June. Well, 1,570 odd PCMs have yet to submit the documents, but since the submission of the paper, we have received more reports, and now the figure stands at around 1,470 odd. Some operators told us that they may not carry the product anymore because of say the popularity or business turnover of the drugs concerned. The past 2 years, 1/3 of the products were no longer sold in Hong Kong. So from our communication with the industry, we understand that some of them have their own business strategy. They have no intention to continue to sell the kind of drug, and for some of the drugs, they were not sold in Hong Kong in the past 2 years. The decision by the CMB is that after the 30th of June, there will be 3 more months for operators that have not submitted any documents so far. They have taken into account a number of factors. In fact, it was announced in 2005 when HKP holders have to submit what kind of reports that they've been known to them for more than a decade. In fact, the first deadline was set at the 30th of June 2009. But in the light of difficulties encountered by the industry, CMB moved the deadline to 2013 and then lastly to 2015. And CMB believes that there is no longer any need to further extend the deadline. However, they have given the industry an opportunity to submit the papers retrospectively, and they will give consideration to different cases on their own merits. Although the deadline may be passed, but these products can appeal if the holder believes that there is a special case or there is a special need, then they can appeal to the CMB. Mr. Yu. So we're told that 1/3 of the products are not being sold in Hong Kong. Is there any information of drugs produced in Hong Kong and exported? We have included import and export figures, and those drugs have also not been exported during the period. And after they have got a HKC status, what about drugs that were still packaged in HKP? you allow them a grace period of 12 months. Is that already the maximum? Has any manufacturer told you that 12 months is still too short and ask for a longer grace period? Dr. Lam, thank you. I think Mr. Yu is talking about an HKP holder that has successfully got HKC status. We are flexible. In view of response from the industry, in fact, some holders would like to change the packaging ASAP. Some would want to sell all their stock first. So 12 months is a ceiling. If the HKP holder has received notification that the PCM can be now HKC, then they can choose a period, and the cap is 12 months, and beyond that period the packaging has to be changed. So there is an option, yes, and the period will be determined by the holder himself. I know some PCMs may have a longer efficacy period. Without affecting public health, the individual PCMs may apply for a longer period than 12 months on a certain ground. So, but still, the periods cannot be extended for more than 12 months. So the basic arrangement is no more than 12 months, but in exceptional circumstances and without jeopardizing public health, and other 12 months can be granted. Why is it not in the paper? Because at the last meeting, there was the discussion of changing the packaging, and so this point has not been incorporated into the paper. So there is a consensus with the industry that a grace period of 12 months can be is already in place, and when necessary, a further 12-month extension can be sought. Yes. In our briefings with the industry, this proposal is acceptable and popular among them. Well, to be fair, not all of them accepted this arrangement, because once the 12-month period is up, then overnight all HKP packaging will have to be called back from the shelf, and another new packaging will have to be introduced. Mr. Kohim. Thank you, Chairman. I'm not a member of this subcommittee, but the topic of this discussion is transition from HKP to HKC. I have no strong views about this, but what are the how can you streamline and improve the application procedures? In Beijing, as an NPC local delegate, I had the opportunity to meet experts that would like to register some PCMs in Hong Kong. I think even the director is aware of this case. He has been working on it for 4 years and still unsuccessful. And the sticky issue is the terms used and the instructions. And then suddenly the case is referred back to an expert group. So it took 4 years for the registration to be processed. So it's either pass or fail. Well, yes, we are on this topic. I find it so strange. Hong Kong, calls itself a very efficient place, and we want to develop Chinese medicine. And we have this expert in Beijing who has done a lot of studies, and he has also got proofs. So the expert committee already vetted his application, now is referred back to the expert committee, and he doesn't know how long the issue is going to drag, and he has asked a number of times. So I want to help, but I don't know how. And I cannot really identify the major problems. The expert said that perhaps he had offended, because perhaps he has offended some of the staff concerned. I think this is a shame. It's either pass or fail. So the case was vetted by the expert committee before, and now it is referred back to the expert committee for some technical issues. So at this open meeting, I'd like to ask what's wrong, what's happening? How can we develop Chinese medicine if that's the case?
即係其實我就冇點樣參與到佢喺方面嘅討論，咁但係
I hope the Secretary can pay attention to the overall situation, although I'm referring to a case. How can we provide Chinese medicine to our people, good medicines with efficacy, if we drag our feet like that, is it really in the public interest? Is it good for the community? Thank you, Mr. Ye, for your comments. When it comes to registration of Chinese proprietary medicines, we have devoted a lot of resources. Of course, the CMB is the independent body authorized by the law to handle this. And of course, the Department of Health is in communication with the CMB, and here maybe it's not the right forum to discuss an individual case, but I hope Mr. Yip will understand the situation. I heard from you that the time required may be unduly long, and there are a lot of to and fro's. We have heard that comment before, and maybe Dr. Lam can also say something. It's because we want to look at the safety, quality, and efficacy of the product. And there are certain standards to go by. Such standards may have been enhanced because of the development of Chinese medicine, the new findings in research, and so on and so forth. I would like to defer to Dr. Lam on the relevant issues here. Proprietary Chinese medicines must satisfy the criteria on safety, quality, and efficacy in order to get registered. There are two types. We have some traditional products, and the other category is non-traditional products. Traditional products would be able to be registered very quickly. There are traditional recipes, Chinese medicine recipes, and second category. And those manufactured in accordance with the Chinese pharmacopoeia standards on the mainland. And when it comes to non-traditional products, they may be tonic items or health promotion products. These are not found in any traditional literature, and therefore registration would take a longer time. And of course, I may not be able to tell you what the situation is with an individual case, the time required will be affected by the assessment process. For example, we have to look at whether the label or the insert will be in violation of other laws, such as the law on undesirable medical advertisement or trade description ordinance. If in the final stage the problems lie with the label, then there are good news and bad news. The good news is that it's in the final stage of registration. And second, the bad news is that it might have to do with a breach of other laws. So generally speaking, and I'm speaking from experience, that's what we have seen. I understand members and the industry feel that the time taken for the conversion from HKP to HKC is very long. Please answer the question direct. It was April, there was the assessment, and then other problems surfaced after another round of examination, and the whole process has been dragging on for 4 years. Well, I was talking about what could have happened January, leading to the registration taking a number of years. Chairman, we don't know about the details of a particular case. Is it just one case or the general situation? 4 years cannot be described as a relatively long time. It's very, very, very long. You said that when it comes to considering the label, well, it's already near the end of the process. So why is it that the matter is then referred back to the experts? Yes, I agree that we should not lower our standards on safety, quality, and efficacy. If there are problems with these issues, you should have told them no at the very start, instead of going when the process progressed to the consideration of labels and inserts. Then you have to refer the matter to experts, and we don't know when the experts will convene a meeting on the application. Well, that's not the kind of efficiency we can allow. I'm concerned that this may not be an isolated case, and this is the case with many proprietary Chinese medicines. If that's the case, how can we promote Chinese medicine? Well, I'm not saying that we should compromise on safety, quality, and efficacy. What I'm not happy about is that, according to the person who told me this, it took them 4 years, and now the matter is in the hands of the experts, and there's no telling when the experts would hold a meeting on that. I'm not asking you to deal with this in any way other than your established system. I've received this complaint, and I'm concerned that this is going to be the case with many proprietary Chinese medicines. Of course, I will follow up the case through another channel. And Professor, well, I understand the point. As Dr. Lam has said, it's difficult to discuss individual cases here. But of course, we would reflect Mr. Yip's views on the time taken in that particular case to the CMB. Dr. Lam has already told you the process, and in different parts of that process, the applicant might be required to submit further information. Well, they provided everything on request, and that is difficult to understand why it's still not finished. Understood? I hope the DOH, I hope members understand that DOH, that the CMB would communicate with the applicant. Well, I can say that this is not an isolated case. All applicants asking for registration face this, unless you have a very simple recipe, just a mixture of, involving the mixture of a few Chinese medicines. And in this particular case, it's a new invention, and then they have to submit and resubmit information. When is he going to submit, or when is he going to satisfy you? Then when this goes on and on, the applicant thinks whether he has offended someone in the process, and they dare not speak out. He dare not speak out. Well, that's exactly what happened. They did one thing, and then the applicant is asked to do a second thing. So it gives people the impression, what's going on? This is unacceptable. Well, I thought that it was an isolated case. But if that's also the experience of the chairman, then I have this worry. What would happen if you want different items to be submitted, 1, 2, 3, 4, 5? Well, you say so. And now it's not like this. The applicant is required to submit one thing at a time, and then once the first request is met, then there's a second one. Well, this is a total waste of time. And if you don't have sufficient manpower, say so. We are here to monitor the work of the government. In this case that I'm involved, that's totally unacceptable. Dr. Lam, well, I certainly understand the frustration of the applicant in that case. Chairman, two things here. On the whole, the CMB gives a lot of time, ample time, to the applicant, and also to the supplement information to be submitted at a later stage. Maybe that gives people the impression that the process takes a long time. Maybe for this particular case, we can communicate with the applicant to see what can be done about it. Let me follow up a point raised by Mr. Yip. The method you use is very outdated. Seldom do we find it in other areas, other fields. You ask one thing, and then another thing next time, and then you may be asked to resubmit something that was previously submitted. So you are forcing them to switch the category from Chinese medicine to tonic food, because that spares the applicant of the trouble of registration. And we have many tonic food items with Chinese medicine. Registration is difficult. And sometimes the CMB don't know whether something should be allowed, because Chinese medicine is complicated, and if the CMB wants to play on the safe side, they would say no. They would keep the product out of the market, and that's the safest to the CMB. the threshold required is very high. With just one standard, HKC. You have to show quality and safety. This is the basic threshold. You look at the residue, the absence of heavy metal, and then also you can monitor or ensure quality through the monitoring to manufacturing process. But efficacy is difficult to prove. You need to go to a test. You have to take out certain contents from the product, and then they come up with the right indicators to show efficacy. But that may or may not be proof of efficacy. If someone buys a medicine and then the patient finds it not to have efficacy, and there may be a litigation and seeking damages.
But for the FDA, they will allow registration so long as the quality and safety is okay, and they will have a disclaimer that efficacy is not substantiated because it's so hard to prove the efficacy. So even using your standard of testing, you cannot really confirm the efficacy, even it has a certain ingredient or a component with the efficacy. That doesn't mean that the PCM ends up having that efficacy. I can give you a lot of examples. So I think Mr. Ip Kok Him has just pointed out a problem, which is the tip of the iceberg. Perhaps our legislation should be really reviewed. Perhaps the Undersecretary doesn't agree with me. Undersecretary, thank you. Thank you for your comments. I think there are two things. First, PCM operators or manufacturers, and also or the applicants objectively they feel that the processing time is too long. We have to address this sentiment and let them understand what's happening. The intention of the CMB is not to be in the way of their certification, because we have done so much. All we want is all the documents from them on quality, safety, and efficacy. This is the objective of the CMB. If not, we don't have to spend so much resources on it. But if the subjective feeling is that the whole process takes too long and there are a lot of things they're not sure, then we must enhance communication with them to let them understand the reasons and to let them understand what is the next step. Mr. Chen talked about the regulation on efficacy, safety, and quality. I think efficacy is a very important point. Of course, there are other things in the legislation that needs reviewing, but I think for efficacy, even FDA will consider the efficacy. There must be clinical trial to confirm that. Otherwise, it is hard for a PCM to claim what is its main use. Dr. Chen, Dr. Lam. Yes, allow me to supplement. Efficacy, because PCM is also a kind of drugs, so there must be proof on the efficacy. If it is based on an ancient prescription or there is already objective proof of its efficacy, then the CPM will, the CMB will require it to give us more information. We encourage, we'll always give opportunities for the applicant to provide supporting documents, and this may have created the impression that they are forever asking for new documents. We will bear in mind this situation. The CPM has already endorsed a simplified way of dealing with such applications. For instance, proof of quality. In the past, the indicative components must be separated. But now, without public health, any impact on public health, even if there is only one indicator, then there can be a conditional approval of HKC, and such documents can be submitted retrospectively upon renewal. So CPM has already endorsed this arrangement, and I hope this can expedite the whole process. Chairman, I've already exhausted all my views. Now, if we are not talking about ancient prescription, but new prescription, I know it is challenging to confirm its efficacy. But you should review whether it is indeed the attitude of your frontline workers, because we are talking about 4 years. It's back and forth. You talked about giving them opportunities. Is it really the case? You should ask for all the documents, give them a list of documents required. It is better than asking for some of the things after the documents required have been submitted. With due respect to experts in the CMB, I think we should improve the system. I think the case I encountered might reflect the general situation, because this will be a disincentive for people to market good PCMs. I don't think I have any more to say. I may follow up with Dr. Lam, but I'm really very dissatisfied with the situation. You should either say yes or no to an application and don't drag your feet like this. Thank you very much, Mr. Eve, for your attendance. Now it is my turn. I think we can continue with our discussion of previous issues. The transition from HKP to HKC, the gap is too wide. Will the administration review the legislation which has been in place for 16 years already? Would it be the CMB or the administration? I'm sure they've accumulated a lot of experience, and we can also take reference from overseas practice. Can there be another status in between HKP and HKC, such as HKS, meaning that it is safe? Can that be done? Can the administration review the legislation? Because you've accumulated a lot of experience. There may be cases similar to the one mentioned by Mr. Ip Kwok Him. can there be different thresholds for registration of HKC? Otherwise, they may come in to Hong Kong for sale as a form of health food. That may not be in the best interest of the community. If the government doesn't amend the legislation, I think many PCMs would choose to call themselves health products or health food. Will you consider reviewing the legislation? Thank you. We are dealing with many applications of transition from HKP to HKC and HKNP, and we have extended the deadline many times, and the 30th of June is the last deadline. Of course, we will allow another 3 months for submission of documents. Let's deal with all these cases first. At this stage, we've heard your comments, and when it comes to the threshold and also the procedures, we will fine-tune them. We've made changes in the light of views expressed. So, while the legislation remains the same, I think we can have different handling. Given that a lot is happening under the legislation, we should complete the current exercise first before we change it. Otherwise, it will not be fair to other applicants. Yes, there are matters arising from the current system, such as health food products. We will see how we can enhance the arrangements to plug loopholes. As regards how we can adjust the whole process with the view of encouraging registration. In fact, we review our process from time to time and will further reflect our views to the CBM. Let's see if Dr. Lam has anything to add. As you mentioned, Chairman, in the past few years, we have an increasing number of HKC PCMs. After the deadline, dated the 30th of June 2015, we will have a better idea on manufacturers that do not want to carry these products anymore. Because some PCM manufacturers have not submitted any documents even after a lot of persuasion from us. So we'll see how we can expedite the transition. I hope that in between HKP and HKC you have another level of registration, HKS. Otherwise, many HKP PCMs may want to be marketed as health products, health food, because the current system is too difficult and too hard to understand. Mr. Yip mentioned a case that took 4 years. I'm afraid this system will scare off many manufacturers. This is not conducive to public health. So 1,300 odd PCMs have not submitted any documents so far. Although some manufacturers are being selective, they have to spend a lot to submit all the necessary requirements for registration of HKC. On news report, we saw the case of CMPs who decided to mortgage his flat in order to seek registration. Some may choose to give up 15 PCMs and only registered 5. From a point of cultural heritage, we will then lose 15 PCMs. So for these 1,000 PCMs that have not submitted any documents, now from the point of cultural heritage, if no documents are submitted after the deadline and even the 3 months that follow, we can freeze the PCM HKP status for 15 years. If the descendants of the manufacturers or holders concerned decide to seek HKC registration, can that be allowed? If such documents can be accepted before the freezing period is up, perhaps the administration should accept it so that we will not lose our cultural heritage.
呢啲交，呢啲唔交，因為可能嗰啲市場。
Well, they will be selective in submitting applications because of market considerations. We don't know what would happen to the market in the future. Can some flexibility be exercised by the government in this regard? For details, I'll leave them to Dr. Lam. Let me stress again here that basically this is the CMB making the decisions. So whatever suggestions we receive, we have to refer them to the CMB for consideration. Dr. Lam, Chairman, you propose a separate category for the transition, for example, from HKP to HKS. We have to understand whether this is sound in terms of the legal basis. HKP can be marketed legally, and HKC is the formal registration. If we have a freezing arrangement for other products, there will be problems with enforcement. That's the initial point that I can think of. Second, if we freeze the registration, and that is to say, for the time being, these products cannot be marketed. Well, in the law, we stipulate that HKP and HKC products can be marketed. We cannot go beyond the law. For example, CMB makes such an announcement. The 1,000 odd products for which no information has been submitted. Then as long as the products enjoy the HKP status, we cannot prevent them from being marketed. Of course, we can seek the advice of CMB. And then that will lead to other problems. For example, for those products which have been rejected registration under HKC, would they ask for the HKP status to be reintroduced so that they can enjoy the freezing arrangement? And there are also problems with future applications. If the CMB wants to reject an application, the applicant may then ask for the freezing arrangement to be applied. So these are the complications that I can think of. But as Chairman, your suggestions will be referred to the CMB, and it will be asked to look at the legal basis of doing this. We're still in the initial stage of the registration and verification and testing. So if it fails the verification process this time, it may be able to pass it in the future. I just don't want to have a cultural disaster. Sorry, Mr. Yip, I have one more question. If all information has been submitted in support of the registration, and if that's done after the 30th of June, and let's say there's something missing or something to be submitted later, you allow them to submit the information later, or you allow submission of supplementary information. Some manufacturers, medicine companies are very concerned. Do you mean that after the 30th of June, or as long as the relevant documents are submitted? Of course, we want them to submit the full set required. Let's say, in respect of one indicator, the lab is still has not yet done the test. In the past, there were cases that a longer time will be allowed. The important thing is to offer the explanation and also to produce objective proof within the time allowed by the CMB. I'll take it up at the next meeting. And lastly, I have one more question.
就關於個 tutorial 嘅問題，
It's about tutorial.
其實應該係設計一個第三方去。
I'd suggest that there should be a third party providing assistance to the manufacturer. We have been having problems over the years, and the manufacturers were helpless because the Department of Health is just like the examiner. Is not supposed to offer tips to help the candidate. So the compliance prospect has been very long. You may have organized exchange sessions. You may have to offer free advisory service or to involve universities offering help. So you may have to find money to set up a different budget to help manufacturers of proprietary Chinese medicine, for example, some quasi-government organizations, and involving people who are familiar with the registration process and offer free advisory service to the manufacturers. And that would help them to migrate from HKP to HKC. Would you consider this? Dr. Lam, if you don't mind, I would like to defer this to Dr. Lam. Our support to the industry comes in various forms. They can phone us. We also got the technical exchange forums. It's usually held once a month. And in May, we would discuss cases whereby there are technical problems. From what we have collected through the technical exchange forums, the industry views are positive. As for the setting up of a third-party consultation forum or platform, we welcome it if it is available. AOB, we still have 5 minutes. You have extended the meeting? The chairman can extend the meeting for 15 minutes. I have a question about GMP. From HKP to HKC. I presume that from HKP to HKC is going to be successful. But what about GMP? Many in the industry cannot pass that threshold. You offer consultancy service. You also provide training, and you have got a research unit. To what extent can the problems faced by the industry be resolved through these channels? In the public hearing, well, some of those in the industry accepted that, but most of them, many of them, did not accept the GMP standard. So if at the end of the day half of the manufacturers go under, you still insist on having that? Thank you. We propose GMP to help the industry enhancing the quality standards. This is for the question of going global. And the mainland has done this along the line of GMP. Of course, we understand the sentiment in the industry. Some can achieve that. Some have difficulties. So let's look at those with difficulties. We look at what difficulties they face and what can be done to assist them. For example, the Innovation and Technology Commission may be able to help with difficult issues, with technical issues. But if they cannot reach the standard in whatever manner, well, they have to reconsider the way forward. We don't have a deadline for achieving that standard. We hope at this stage people would talk and discuss about the assistance that may be required and whether the proposed solutions are really helpful. And we also propose to the industry that for smaller manufacturers, maybe it's a good idea to merge some of them. And we have conducted some pilot studies on what would happen if some merger is established. We don't have a timetable. I believe the industry all want to go for quality. Some are saying that they cannot do it. There's still time for communication with government and in search of solutions. Dr. Lam may wish to supplement. As the Undersecretary has said, there's the Biotechnical Research Institute under the ITC offering assistance. Well, they can manufacture the products through a contractual arrangement. But the industry's culture is that they are not accustomed to contract manufacturing. So we have to see, is SMEs in the industry accept this and whether the facility is popular. If a contract manufacturing can be accepted, well, it may be a way out for SMEs. And that is they can reach GMP for their products through contract manufacturing. A lot would depend on the interactions after the manufacturing facility is up and running and the communication with the industry. Well, if manufacturing facility is one thing, you should provide some incentives to the industry. I know some of the people would like to see this done. You should find ways to attract more participants, and then other manufacturers may then decide to join as well. Some are interested, according to me, so please be more proactive. We have spent quite some time on meetings related to discuss issues of Chinese medicine. Today we have been given a paper. In response to my questions raised, and that is the application and adoption of Hong Kong standards. So today we have made a number of points. We want to revise the law and also to offer clear guidelines to the industry, and the government should offer assistance for manufacturers to achieve the GMP standards. And for example, there should be a dedicated fund to offer assistance. It's just for example, it's just like the setting up of a fund to help fishermen to get new vessels. And we should also help the industry in reaching the relevant standards and requirements. And we did not spend a lot of time on the market of Chinese medicine. We haven't got the chance to discuss the common platform of Chinese medicine for Hong Kong and the mainland. Before the summer break, we are going to have another meeting. We need to cover other issues. So for the next meeting, we will be talking about relevant issues and also certain medical products and the difficulties faced by the DFH in recalling certain products. We'd like to know more about those cases. We'll take up the details with the department in due course. So meeting's adjourned.